The Doppler ultrasound, as its name implies, uses the Doppler effect to measure the velocity of a liquid flow, and in this case, the blood flow in the CL. The color mode represents the blood flow by coloring the vascularized structures. Here is what you can see with the Doppler ultrasound. You can see here the CL as well as the blood flow in a vessel. Note that the blood flow in vessels outside the CL are also visible. We will soon explain in details how to use the Doppler ultrasound and interpret its images. Now that we have seen the vascular changes associated with the establishment of the pregnancy, it is easy to understand how to use the Doppler ultrasound to diagnose non-pregnancy 21 days after insemination. As we saw previously, the absence of blood flow in the CL at this stage should indicate non-pregnancy. We will first discuss the accuracy and the concordance of the Doppler ultrasound. The accuracy of the Doppler ultrasound to identify non-pregnant cows has been shown in 2 studies. These studies are available in the reference section of the course. In both studies, the sensitivity of the Doppler ultrasound to identify non-pregnant cows was 99 and 100%, as was its non-pregnancy predictive value. Let's review what sensitivity and predictive value are. The reference test, in this case, is the pregnancy status, and the studies use the status at 30 and 32 days post-insemination. The sensitivity is then the ability of this test to identify cows as pregnant. Consequently, it is the probability that the pregnant cows are identified as potentially pregnant by the Doppler ultrasound. This characteristic is very important for this test, as the higher the sensitivity, the less false negative there will be. That means few to no pregnant cows identified as non-pregnant. A sensitivity of 100% indicates there won't be cows falsely identified as non-pregnant. The non-pregnancy predictive value is the proportion of cows identified as non-pregnant by the Doppler ultrasound that are indeed non-pregnant. We do not, indeed, want to identify pregnant cows as non-pregnant, which we obtain here with a non-pregnancy predictive value of 100%. An important characteristic of predictive values is that they are influenced by the prevalence of the condition. In the studies reported here, 37 to 40% of the cows were pregnant. Therefore, predictive values in different populations could be marginally different. By putting numbers in the 2x2 table on your right, you can see that the sensitivity and the non-pregnancy predictive value of 100% result in no false negative diagnoses, meaning no cows identified as non-pregnant by the Doppler ultrasound were pregnant. As you know, a high sensitivity comes with a lower specificity. For the Doppler ultrasound, it means that the probability to identify all the non-pregnant cows as non-pregnant is low. This implies that multiple non-pregnant cows will be identified as potentially pregnant by the Doppler ultrasound. This highlights the importance of doing the traditional pregnancy diagnosis at 35 days post-insemination, which we will discuss again later in the course. The pregnancy predictive value is also low as multiple cows identified as potentially pregnant are in reality non-pregnant. Indeed, a third to a half of the cows identified as potentially pregnant with the Doppler ultrasound are in fact non-pregnant. The specificity and pregnancy predictive value of the Doppler ultrasound are greatly lower than the sensitivity and non-pregnancy predictive value. In this context, false positives have a smaller impact than false negative results. Taking action on a false negative, or in other words, on a cow falsely identified as non-pregnant, would result in the loss of the pregnancy. For a false positive, or a non-pregnant cow identified as potentially pregnant, the cow will correctly be identified as non-pregnant at the pregnancy diagnosis 35 days after the insemination, which minimizes the impact of the error. The characteristics of the Doppler ultrasound were chosen because when you do an early non-pregnancy diagnosis, The goal is to take action on the non-pregnant cows and decrease the interval between inseminations. It would be a great disadvantage if you mistakenly identified pregnant cows as non-pregnant and started, for example, a synchronization program and lost the pregnancy. It is, however, not so dramatic to think a cow is pregnant, even if she's not, as long as another pregnancy diagnosis is made a few weeks later to ensure action is taken for the non-pregnant cows. The reasons for the high number of false positives are diverse and will be presented in the next section. Another important characteristic to ensure the Doppler ultrasound can be used for early non-pregnancy diagnosis is the concordance of the diagnoses between different observers or by the same observer. To ensure the tool would yield the same results regardless of the observer, the concordance between the results of 5 observers for the same cows was assessed. A great concordance between the diagnoses was found among the different on-farm observers as well as the observers that were only assessing the videos. Finally, to assess the reproducibility of the diagnoses, the same observers repeated their diagnosis on the same cow and the same videos, which also resulted in good concordance. If a professional is well trained, we can conclude that she or he will make the same diagnoses as their peers.